Hi everybody, I'm Tony Perez, and today I'm with Dr. Victor Osegueda from PRMEDICA, which is a new clinic here in Los Cabos. How are you, doctor?
I'm fine, thank you very much, Tony. Just here enjoying the sun a little bit.
Yes, indeed. This is a wonderful place, but most people come here for vacation.
Yeah, well, it's Cabo San Lucas, and Old Cabo is being known by its tourism and its beauties everywhere, and everybody wants to come here as a tourism place, and that's it. But we also have another plan for Los Cabos, which is involving it into the medical tourism field. So we're working on that. We're actually getting very good response from a lot of people from all over the world, but mainly from the United States, from Canada, which are geographically our closest neighbors, right?
Sure. Before we get too far, let me know a little bit about yourself. Where are you from, doctor?
Well, I'm from a smaller industrial place near Guadalajara. The place is called Tepic. It's in the state of Nayarit, here in Mexico.
And you study medicine where?
Part in my hometown, one other part in Guadalajara, where I finished my training and also started training for emergencies or medical emergencies. During all this time, I was always involved in some kind of another of medical tourism. But then, about 9 years ago, we started working on regenerative medicine, or regenerative medicine called my eye, to say it somehow. So I did my first major in regenerative medicine per se. We were working at the time with only ozone therapy and hyperbaric medicine and things like that involve a lot of oxygen treatments. But a few years ago, once we perfected some of our techniques, we started working with biocellular products. With this, we're talking about cells, we're talking about tissues. In a very particular case, with stem cells, with mesenchymal stem cells, which is our major treatment, our most successful protocol, combined with other.
Well, that's very interesting. How about if we go downstairs and have something to drink, and we'll talk more about medical tourism and the other aspects of PRMEDICA.
That's great. That sounds good.
Dr. Osegueda, you were telling me about regenerative medicine.
Yes, Tony. Well, regenerative medicine, it's the specialty at our clinics. We basically have several kinds of therapies depending on what kind of condition we're trying to treat. You can't really generalize a patient with a degenerative disease just because it's degenerative, because it involves different kinds of tissues. So right now, one of the most successful protocols that we have is our stem cell therapy, which involves the use of mesenchymal stem cells that they come from placenta tissue, from a donor. Here in Mexico, that's completely regulated, and we have all the permits and the certifications to do that. That's one big difference of why we have a lot of visitors coming from Canada or from the US, for example.
I wanted to ask you about that subject, medical tourism. It's a growing industry here in Los Cabos.
It is. It's actually growing very, very fast. And again, that's because this is a beautiful destination. And you really have all the easy access to go anywhere you want to go, and you have a lot of places to visit, and everybody's so nice here at Cabo, so it's been world known as a great destination for a lot of years now. But I think this is coming even more alive, and our patients maybe see first the destination and then see if they can go through a medical procedure while they're here.
It's a wonderful idea to be able to take a vacation and have regenerative medicine at the same time.
Same time, yeah. Even we can also talk about preventive medicine, which we also do. There's sometimes that a patient come here for 2 weeks, 1 week, and we can do a full body executive checkup, for example, in 1 day. It takes us actually some hours to do the whole uncomfortable part of the checkup, and then you're free to go and just enjoy Cabo,
It's a great idea. Doctor, in a nutshell, what is regenerative medicine?
Okay, well, regenerative medicine, it's the discipline of medicine or the branch of medicine, allopathic Western medicine, that it's in charge of rebuilding or healing damaged tissues or degenerated tissues, which is the same. There are several causes for degeneration. Probably the most common cause is age. Just time by itself, it will cause a degeneration in our tissues, but we also have, well, all the bad things that we do to our bodies, the bad things that we eat, the kind of things that we drink, or the air we breathe even, right? So also we have injuries, we have accidents, you know, there's several factors that can come together and cause a patient a degenerative disease.
I see. And what are the services that you offer in this sense?
In the sense, okay, normally we always like to treat a diagnosis and not being treating symptoms all the time. But we have two kinds of services basically on our clinic or clinics. One branch is the fully and pure regenerative medicine, trying to grow, trying to reproduce tissues, the ones that we're able so far to grow. And there's another branch which involves taking away the symptoms of our patients. In this case, we can talk mainly about pain, for example, which is something that at certain age it becomes very common in our patients. Aches and pains here and there, a little rubbing here, a little rubbing there, a clicking and a popping, you know, all these kind of things that comes with age. Or we also have patients that, you know, they live a very competitive and very intense kind of life, you know, in a sports wise, for example, and they get injured several times and they get several surgeries to correct those injuries. So after a while, they don't even have to be very old. You know, our youngest patient, it might be in the 30s. The oldest patient we have right now, it's 94, 95.
So it's something for everybody.
Yes, basically, you can say that regenerative medicine can be for everybody, because everybody has a problem somehow. You got even a sprained ankle that it's been going on for a couple of months and you can really get rid of, and that you've been taking this pill and that pill for quite some time and you don't see any difference on it. So there's another kind of approach to those injuries in which you can relieve pain right away and fade away or remove also inflammation, swelling in a couple of days instead of taking weeks or months.
And doctor, let me ask you this question, which just to clear my mind. What are stem cells?
All right, that's a good question. I think it's a basic question right now, right? Well, stem cells are the foundation of our bodies. They are the cells that can divide infinitively without losing their properties, and they can become several tissues or specialize at becoming several kinds of tissues, not all of them, which that's very important to pinpoint, I think. There's 4 kinds of stem cells. 2 of them have no clinical use at all. The other 2 kinds, it's one embryonic stem cells, and the kind that we're using, it's called mesenchymal stem cells. Embryonics have a lot of setbacks, a lot of side effects and undesirable things, and they are hard to control, so nobody's really doing any research on them. But with mesenchymals, we're talking about a different story. It's a very safe kind of cell, and it's a very safe imperfection procedure to get those cells too.
And where do they come from?
They come from donors. It's a placenta, or they take a small sample from a donor's placenta. Why placenta? Because it's nothing special, it's just there's more concentration of those cells in that placenta than anywhere else in the body. You can find mesenchymal stem cells in everybody's system, even yours or mine. If I poke your bone marrow, for example, and I take some of your adipose tissue, some of your blood maybe, and I process that, I will be able to get some stem cells, you know. but at certain age, they're not the best quality of stem cell. And also they are not in the same numbers as a very healthy person, so a very young, healthy person. So with placentary mesenchymal stem cells, what we get is a very high concentration of stem cells, very active, young, strong stem cells. And also we get the ways to test those tissues even before and after the culturing of the cells. What I mean with this is that first sample of tissue that they take to culture all the millions or billions of stem cells that we use, it's removed and destroyed after we get the exact architectural copies of stem cells.
So how safe are they?
No, they're very safe. Again, we test right before culturing and previous to the culturing, but again, the original tissue gets destroyed, so your body will never get in touch with someone else's stem cells, per se, right? So anyway, before the stem cells are shipped to be sent for treatment for a patient, are retested. And the laboratories that we work with, they send a biosafety certificate, for that particular batch of cells, right? So they're very safe.
And what are they used for? What kind of symptoms are they used for?
Okay, well, stem cells take a little while to grow into the tissue that we want to develop. So this is mainly an indication right now for orthopedic issues, in which we involve all the joints and the articulations in the body. It might be due to just age, just arthrosis, degeneration. It can be caused by systemic diseases like arthritis, like rheumatoid arthritis, for example, or it can be an injury or a surgery that didn't really heal properly.
And it works very well for connective tissues.
That's it. That's actually the only kind of tissue that we can regenerate. So that's why we're very straightforward with our patients about the kind of conditions that we can treat and the ones that we can't. We can only develop or reproduce cartilage, bone, ligament, tendon, muscle, skin, blood vessels, and hair.
Oh, that's a great step forward in medicine, isn't it?
Yeah, well, we're working on getting more kinds of tissues, you know. Right now, we're still working on trying to develop brain or neural tissue for persons that have had accidents or strokes or something like that, right? And other kinds of cells to treat cancer, for example, or symptoms of HIV/AIDS. But there's still some years from now.
And tell me about ozone. What is ozone?
Ozone, well, that's one of our favorite tools. Ozone is a gas. It's a highly oxygenated or highly concentrated in oxygen gas, which we can find in our atmosphere. It's not a substance, it's an element. It's a natural element.
What is it used for?
Well, depending on the concentration, we are using it for fighting off inflammation, swelling, and pain. It's the most powerful pain substance or pain element and anti-inflammatory known by men, and it's been very widely used in other countries too. It also has a function as an antibiotic in high concentrations, but for the uses that we are giving it right now, we're using it as an anti-inflammatory and pain medication. Basically, our patients come with pain or walk in with pain and walk out of our clinic without pain.
Oh, that's terrific.
Yeah, that's very nice, actually.
And what about PRP?
Well, PRP stands for platelet-rich plasma, which is nothing new. That's been going on for quite some time. We know that it has its strong points, its low points too, but it's just a complementary treatment to our stem cells. Stem cells follow platelets because platelets have a very high and fast response to injury and to swelling. So normally stem cells are slower, and when they roll around and see a cluster or an island of platelets, they go there and see what they can do. So what we do is we get them together before injection when we're talking about local infiltration on joints, for example.
And how do you go about getting the platelets? I mean, what's the process?
Yeah, it's a basic blood sample that we take right before doing the treatment or the injection on a particular articulation in this case. And that takes about 20 minutes, 25 minutes to get. After that, I ozonize that PRP, which is something different. That's something that anybody is really doing. And it's giving me great results because that way you can treat the pain right away after the injection instead of waiting for 3 or 4 weeks until the stem cells get enough cartilage right there to stop feeling that symptom. You know, you feel the relief right away. So that's why we're using ozone in conjunction with the PRP.
And are they safe?
Yeah, well, they're your own. It's your own cells. And the concentration that we use for the ozone in the PRP that we apply, it's again, it's low because we want it to treat pain and inflammation, swelling. So it's very safe. It's a very low dosage.
And what is this about? A Myers cocktail?
Oh, Myers cocktail. That's something that also has been going on for quite some time. And it's basically a vitamin oligo element infusion of an intravenous bag, an IV bag. In that cocktail, or in that combination of different elements and medications, we're trying to first get back your normal levels of nutriments, the ones that you should have all the time.
Usually bring you up to your normal level.
Yes,
right?
which normally all of us have a diminished level on one or the other. It's very hard to get all of your nutrition elements just on your diet because we don't have that variety of foods. You know, when was the last time you had beets, for example? You know, it's at least a couple weeks ago. It's not like an everyday meal. And we also don't eat a big group of foods that we should eat more, which is vegetables. We are almost all our foods, it's carbohydrates and meat. So that comes to the other issue, which is heavy metal poisoning. When we do the Myers cocktail with the vitamins and the oligo elements, we also normally do a chelation treatment. Chelation is the removal of those heavy metals from your blood flow. And we can achieve that by using substances that attract those heavy metals, like iron, like copper, like aluminum. At least 7 different kinds of heavy metals that you can get poisoned of without even knowing it. Of course, normally we test before we do the chelation for heavy metal poisoning. But anyway, almost everyone has a slightly higher level of most of them. So we do a chelation process.
And what about skin rejuvenation?
Well, yeah, that's another field. We're working closely with our plastic surgeon team. Between them and our laboratories in Mexico City, in Guadalajara, they developed a protocol in which they are using mesenchymal stem cells plus something called fibroblasts. Fibroblasts are an already specialized cell which produces collagen and produces elastin and gives, structure to the top layer of the skin. But also we treat the deepest layers of the skin and the muscle that it's under the skin with our mesenchymal stem cells, which, as we were talking about it a couple minutes ago, they can regenerate the kind of tissue that it's under the skin. It's connective tissue. Okay, so that's their specialty. And with those two things combined with our PRP, they're getting very good results on having a fresh, natural, not very dramatic effect on the skin of our patients. This rejuvenation is for someone that wants to age, but age in a proper, healthy way. That looks, from a person probably a little younger than their age.
Nothing wrong with that.
Yeah, there's nothing wrong with that, but not looking like they went through a lot of surgeries to get that result. you know, trying to improve the glow of the skin, for example, trying to reduce the imperfections and the spots, for example, trying to fight back the wrinkles and the areas that we don't like, right? But not trying to overly reverse them. That's really impossible without getting into a surgical procedure.
And it doesn't look natural.
That's right, that's right.
And all of this, is this what you call dermablast?
That's a dermablast plus treatment, yes. That's a combination of the three elements that, and well, our plastic surgeons also add a doses of hyaluronic acid along with the PRP, the ozonized PRP, the mesenchymal stem cells, and the dermablast. They also do something called biofiller that they prepare from your own plasma, the pore platelet rich plasma. So they make or turn it into a gel or a paste kind of product, and they can feel the most noticeable lines that are really, really bothering, which is temporary, but it's again a very natural effect.
Well, that was my next question is, how long does it last?
Well, the benefits of getting a skin rejuvenation or even an orthopedic treatment done are permanent or very long term, depending on how the patient takes care of the area that we treated. For example, if we do a dermablast plus treatment on a patient, we treat the face, the neck, cleavage, and both back parts of the hands. And this patient goes into the sun for too long, never uses sunscreen, it doesn't eat well, doesn't exercise, they don't drink enough water, they don't take any supplements, they're very stressed, they're not happy persons. All these factors come together to decide how long it will last. Talking about skin, talking about orthopedic treatments, if we have a patient, which happens, it's very common with our patients, they're very extreme. They feel better after treatment, they don't feel any pain anymore, they can do their normal things, and they say, okay, I'm fixed. Now I can go and do my normal extreme skiing, or my roller riding, or they do all kinds of things, and then they injure the new cartilage, which in a lot of the cases it's not a permanent injury. We can treat them and everything comes back to normal, but again, it depends on how you take care of yourself.
What are biofillers?
The biofillers is exactly what we were talking about 2 or 3 minutes ago. When you go into a dermablast treatment and after the dermapen, which we use, it's something called dermapen, which is a machine, a small machine that has about 150 small needles, and they go through different depths in the skin with a deposit for our bioproduct, and that way you go through the whole skin in a very safe and very uniform way through the areas that you're treating. Then with the wrinkles or the areas that are noticeable and you don't really like, our plastic surgeon will prepare something called biofiller, which is your own platelet pore plasma converted into a gel, and that's injected directly in the core of the wrinkle and filled, completely filled. That way it's not noticeable anymore. But that's temporary. That lasts for about 2 or 3 months.
And if you take care of your skin, if you wear sunscreen, how long does it last?
It's a permanent benefit. It will take you back into several years of age, skin-wise, right? And it will be noticeable mainly on the spots and on the most soggy areas of the face, right? And that, if you take care of it, it will last for a very long time. I mean, the aging process will keep going, but you will already be reversed it for 5 or so years. So you will look different than the rest of your partners that have your age, right?
Sounds wonderful. tell us again, where are you located?
Well, we're located, we have two clinics right now. One of them is in San Jose del Cabo. The other one is in Cabo San Lucas. The first one, it's in the main road. Both are in the main road. And they're close to one of the big malls, which is called La Comer in San Jose, right in front of that mall. And the other one, it's across another mall, which is Home Depot in Cabo San Lucas. It's an easier way, I think, to give instructions to get into our clinics.
So it's a wonderful opportunity to have stem cells, to have rejuvenative medicine done, take a vacation, be in good hands. Thank you very much, Dr. Victor Oseguera, for sharing your knowledge with us.
Thank you very much, Tony, for visiting us here and let our patients know all the things that we're offering and all what Cabo has to offer to them, right?
Thanks for being here.
Thank you, guys.